front end to involve communities seriously in the design of programs. Developing feedback loops. There's one project in here that actually built into its M&E sort of a complaint mechanism. You could call up and make a complaint, you know, and then they use that data to continue developing their program and improve it along the way. And finally, this idea of moving more towards a brokering and convening role, finding ways to get out of the necessity of legally established entities only. And that would also mean not just those entities that can meet large donor requirements. You know, how do we support smaller groups that are beginning to emerge? And looking at not just the tangible financial output-oriented results of projects, but how do we begin to learn to measure the intangible, the social capital of trust building, of relationship building, of forming relationships with government or with other civil society networks, that then builds a foundation, a much stronger foundation for sustainable development. So we're now beginning to move into a new potential project where we would try to figure out how do you measure some of those intangible results and help shift some of the focus to that. So that's a summary of some of our current work. This is Matt's email and the website. There's a newsletter, email newsletter that you can get with lots of good research and information coming out of it. So thank you very much.
Thank you. Okay. One of the reasons that my organization is wild about strengthening local governance is that is where grassroots women can exert voice and power. And we consider that as really our highest priority, is the voice and agency of women in taking charge of their own lives and destinies. One of our advocacy and programmatic partners in our work is the Center for Health and Gender Equality that Mary Beth is here to represent. And I'll fire up your PowerPoint. Do you want me to click it for you, or do you want to?
Yeah, that's fine.
Okay.
I'll just, it's not going to be too complicated. There aren't that many slides.
Okay.
Thank you, John, and thanks to all of you for being here. It's really exciting to be a partner of the Hunger Project. It was a pretty unexpected relationship for change. We do engage advocates around the world and bring some of them to Washington to talk to policymakers. We are a U.S.-based advocacy organization. We focus on sexual and reproductive health and rights of women and girls, and exclusively how that is, or almost exclusively, how that is reflected through U.S. policies and programs. So we really focus here in Washington, D.C. on shaping the policies that come out of the U.S. government, and also their role in institutions like the World Bank and others, the United Nations, and how those policies ultimately affect women and girls and protect their health and rights. And so the partnership with the Hunger Project emerged out of a workshop we did a number of years ago in Swaziland, and we had a representative from Malawi, from Hunger Project Malawi, at that workshop, and I'll talk a little bit more about the work that THP Malawi has done, which is a really exciting, I think, example of the way local actors affect global development and advocacy. So the title of my presentation is Sustainable Advocacy and Sexual and Reproductive Health and Rights in Guatemala, and I really just invented that term of sustainable advocacy just today. So I'm just kind of testing it out on you guys, so let me know what you think about it. And you can just go to the next slide. So the question is, what does advocacy have to do with sustainability in that local level governance? Well, obviously, I think, as John very astutely pointed out, you cannot have effective local governance without an engaged citizenry. And this kind of harkens back to my days when I worked at the League of Women Voters, and which is an institution. It's really the local governance experts in the United States. They have chapters all over the country, and they really focus on transparency and and those local governance issues, as well as having a national office here in Washington. So this idea that that local actors need to be engaged, I think that's CSOs are really vital to that process. And so that's something that's, I think, increasingly recognized, maybe not to the extent that we'd like it to be at this point, but you cannot have sustainable development, you can't have investments in health, education, any of those programs that local governments are supposed to be carrying out without an engaged citizenry. And the Health Policy Project of USAID is one of the examples of that. They are funding advocacy in many countries on sexual and reproductive health and rights. And I'll just talk about the example of Guatemala, and a lot of these pictures are going to be from Guatemala, which is one of the places that we have worked most intensely in the last few years. There's a reproductive health monitoring body in Guatemala that is it's a unique partnership, I think, of civil society and government to look very closely at maternal health indicators and what's happening at the local level on maternal health. So how are women being treated when they go into the clinic? Are people respecting their rights? What is the maternal mortality? They've been collecting their own statistics on maternal mortality. And so holding the government accountable to the commitments they have made in terms of maternal health. And issuing reports, and one of the issues that they came across was the number of pregnancies among 10 to 14-year-old girls. This had not gotten any press in Guatemala until the director of the reproductive health monitoring body did some advocacy, and based on local statistics, because these are all local institutions. Said, here's what this problem looks like in Guatemala. So that information flow from the local to the national was essential. And I'll talk in a minute about how that local to national then goes global. So the issue, though, of holding government accountable to their investments, there's a delicate balance there as well. I think the danger is, or the question is, how much does an institution, how much does a local organization take on the responsibilities, what really should be local government responsibilities, right? Local governments are supposed to live up to these commitments. They're supposed to hold themselves accountable to a certain extent. So how much are we shifting responsibilities from local governments onto civil society institutions? I think that's a really important question to keep in mind. And then the other question is, where's this agenda being set? If these donors are saying, okay, we need advocacy on X, Y, and Z, where is that agenda really being set? And I think Bridget's presentation talks about that a lot in terms of, okay, who's saying what's important in terms of policy advocacy. And I just want to do a very quick distinction between policy advocacy and program advocacy or grassroots advocacy. Policy advocacy is really affecting those higher level decisions, those national level or even local level decisions, but the policy that is going to affect how things are done in a community or in a country or even globally. And that's what Change engages in more than anything else. Grassroots advocacy is building momentum for change, right? And program advocacy focusing on how a program is implemented. Policy advocacy is at a different level than those other two. So then there's the question of donor accountability, and I think this is kind of our next step in advocacy and local engagement in advocacy toward donors. Again, this is something that has to be on the agenda when we're talking about the Sustainable Development Goals. These donors have had interest in supporting local advocacy, but how much are they willing to turn that lens on themselves? How much are they willing to consult with local NGOs about what's going on in their country and to let them set the agenda? I think that starts to make donors shift uncomfortably in their seats, frankly, because because it's a different power dynamic, right? And there's a lack of trust of what local NGOs might say about what's on the agenda. One of the things that we've worked on is getting the United States government to engage more with CSOs on the ground, and this is something that's been really, really tough. Even in the era of country ownership, where that's supposed to be the policy of the U.S. government is country ownership, that's not supposed to just mean engagement with government. That's supposed to mean engagement with civil society. And yet, I've yet to see a good model where the U.S. government engages, consults regularly with civil society, except in the cases where there are people that they already fund. So the big institutions that are usually based here in the United States, they're consulting with them, and they're expecting that they then consult with local civil society, but there's very little direct civil society engagement in the decision making at that level. But the importance of this donor engagement, I'm just going to illustrate with the example of the Hunger Project in Malawi, and one of the things that was going on there was they were working on the issue of female condoms, which might seem like that's strange. They're a poverty alleviation organization. Why are they working on female condoms? Well, it's again, this is an example of local actors influencing policy. A woman in one of their communities had said, "Why aren't there condoms for women?" They're talking about health issues that HIV is a critical health issue in Malawi. Why don't women have access to condoms for them, that they can control themselves? She did not know that there actually was such a product. And so
neither did our staff. They were completely surprised.
They just, yeah. So it was new to a lot of people, and so the questioning process that started from there. Why aren't these available in our communities? And that question started to be asked up the chain. And so their office in Malawi came to our workshop to talk about female condom advocacy, and then started engaging the U.S. government. And I think they probably know more about how female condoms are distributed in Malawi than any other institution in Malawi. But what came to light was that a lot of these female condoms were just sitting on shelves, and the country's health system was not really equipped to deliver these to people who needed them. And so the feedback loop that then went between THP Malawi and the USAID mission there was crucial, because the USAID mission there was like, well, nobody wants these. They're sitting on shelves. And because of that feedback loop, they were able to say, oh, maybe we need to start investing in making sure these go to a different distribution model, and THP Malawi is one of them, and they are doing amazing work in getting these into the hands of the women and men who want to use them. So the other concept on here is the sustainable advocacy concept, and just the whole concept around sustainability. Where does that it really calls on that locally driven, these needs that are keenly felt at the local level. And I think that example where the woman says, "Why aren't these available?" that really shows you that is a locally driven issue. Another kind of principle of sustainability is that there's integration, that there's an understanding of the ecosystem around a certain issue. And the ecosystem for sexual and reproductive health is that education comes to play in it, the cleanliness of the water comes to play in it. They're just all these issues that also have to do with each other, and even within sexual and reproductive health and rights, we define that as maternal health, family planning, and HIV. In Washington, you have family planning advocacy groups, and you have HIV advocacy groups, and you have maternal health advocacy groups, and very few advocacy groups are looking at that issue holistically. And so what happens is that you get a budget from that is being proposed in Congress, and the family planning people say, oh yeah, well it really isn't very good on maternal health, but family planning is great, so we're fine with this. Or the HIV people are like, you know, family planning isn't really that important for HIV, so we don't really care if there are policies that limit family planning. And so it's really important for sustainable advocacy to have that understanding of what is really at the heart of your issue and how does it relate to other issues that may be kind of outside of your field of vision. And then another concept within sustainability is carrying capacity, and I think this is really crucial. What are we expecting organizations to do in terms of advocacy? These local organizations that we just kind of throw them into advocacy. Oh yeah, I think that organization that's doing implementation, they could do some advocacy. And we don't provide the resources necessary to do that. We don't provide the time necessary to do that. And we don't provide the training necessary to do that. And we expect that advocacy is just something really easy. Just go have a meeting with that person. And it's not. It's really something that you have to develop a capacity in. And then the resource issue is really critical. I just got an email from one of our partners in Guatemala saying, do you know anywhere where we can get resources? There's so much hunger to do this local level advocacy and really very limited resources to do so. And then the time is another critical element because so many funders do not understand the time that it takes to get to real policy change. And are, in 6 months you weren't able to change that? And of course not. So the patience to really understand the long process, the long arc that you're going through. And then the last thing in terms of sustainability is I think this connection to global networks. And that's something I think that often gets overlooked. It's like, oh, well, we can support local level advocacy and that's fine and step back. But I think the connection to local networks or global networks is really critical. Part of that is because of that information flow. If you don't have a connection to a global network, how do global advocates know what is on the agenda in your country? And one of the things that Change does, I think one of my favorite things that Change does is bringing people from the field to Washington to say, here's what the local needs are. And nothing can replace bringing a maternal health advocate, for example, whose sister we just did this last week, whose sister died because of a lack of blood when she was in the hospital in childbirth. They didn't have enough blood for her, and she died. So you bring that person who works on maternal health issues to the Hill, and that is just extraordinarily powerful and important for Congress to hear. It's important for the UN to hear, and so that connection is really important. The work that we did in Guatemala, and I think you can go to the next slide. We'll just kind of go through some of these slides, and I know I've been kind of talking a long time, but. You can go to the next one. So these photos are from a workshop or a summit that we were able to convene in Guatemala based on partnerships with different Guatemalan organizations from all over the country. And the way this came about is we were working on the Global Health Initiative, the U.S. Global Health Initiative, which Obama launched in 2009. And one of the things we wanted to see is how is this affecting sexual and reproductive health on the ground. So we went, Guatemala was one of our focus countries. We went there and we worked with local partners to do some interviewing of different CSOs, what's happening in terms of U.S. global health funding. Is it really a benefit to women and girls? And one of the issues that came up was this issue of teen pregnancy and adolescent pregnancy. And that was the issue that they chose to focus on. So one of the outcomes of that discussion, that dialogue, they said, here's an important issue for us. It's not being reflected in what the U.S. is doing. And so let's have a summit about it and have Guatemalan policymakers there and have international donors as well. So you can go to the next slide, I think. So these are just some gives you an idea. So these are Guatemalan officials that came, representatives from the Ministry of Health, Ministry of Education, the Youth Council, the head of the Congress Board of Directors, I guess is what they call it. So some really great people. They came because we had an amazing advocate on the ground who was able to get them there. And this is the declaration that they gave to them and that they all signed. And the result since then is they've had these summits at the state level, at the department level in Guatemala. The youth leaders are currently meeting consistently with the Ministry of Health, and they've developed this youth protocol, for how health services should deal with young people. And they're doing that in local areas. And we were able to bring a couple of these representatives up to Washington a few weeks ago to meet with policymakers and to say, you know, you have a policy on youth and development. Here's how we're seeing this implemented in Guatemala, or not being implemented in Guatemala. And so it's been a really powerful example. We also were able to give small grants to support local advocacy initiatives on this issue. So just to reiterate, I think local CSOs are critical to sustainable development, and the health and education, all of that. But they're also critical to creating this idea of sustainable advocacy and making sure that their voices are being carried up to the global level. Thanks.
Great. Okay, so now, when I first went to India in, I guess, 1990, that was when I really started getting schooled on local government. And when I returned, and because the vision of Mahatma Gandhi was to have every panchayat, they're called, local government, really a sovereign, a little republic with its own power, its own constituency, its own decision-making authority. And of course that really isn't how it turned out in India. A lot of power didn't devolve down to the local level. And the government was spending lots and lots of money on schools and hospitals, but the teachers or nurses would never show up except on payday, because there was no local accountability. No one was holding them to account within 300 or 400 miles. So when I came back from India the first time, and my parents tried to understand what I had seen, I said, well, just include in your thankful prayers that the sewage systems of your town are handled by the town, not by the central government. Mm-hmm. And that, I just think water and sanitation are such perfect examples of how, if it's not being handled well at the local level, it's not going to be handled well, period. And it's just one of those many petals that was on my diagram earlier. But Ellen and I have been very involved together in fighting for